Assalamualaikum, welcome to Dr. Emma's Medicine YouTube channel. In this video, I am sharing some keys of genetic diseases in pediatric. Acute myeloblastic leukemia (AML) is a higher risk in patients with Down syndrome at what age? Answer is less than 1 year. Acute lymphoblastic leukemia (ALL) is a higher risk in patients with Down syndrome at what age? More than 1 year. The best age to screen for atlantoaxial subluxation with cervical spine X-ray in children with Down syndrome is 3 years of age. The most common gastrointestinal defects associated with Down syndrome is duodenal atresia and Hirschsprung disease. The most common cardiac defects associated with Down syndrome is AV canal defects, VSD, ASD, and tautology of Fallot. Screening for hypothyroidism in a newborn with Down syndrome is at what age? Answer: birth, 3, 6, and 12 months, then annually if normal. Newborn with IUGR, failure to thrive, microcephaly, rocker bottom feet, and VSD 90%. Diagnosis is trisomy 18, Edwards syndrome. Newborn with cleft lip, cleft palate, microcephaly, microphthalmia, cutis aplasia, and postaxial polydactyly. Diagnosis trisomy 13, Patau syndrome. A 5-year-old boy with intellectual disability, large hands and feet, long face with large ears, large testicles, hyperextensible joints. Point favor diagnosis: Fragile X syndrome. Newborn girl with microcephaly, ocular hypertelorism, prominent glabella, frontal bossing, Greek helmet face, beaked nose, hypotonia, and seizure. Diagnosis favor Wolff-Hirschsprung syndrome, foot dilation. Newborn with cat-like cry, hypotonia, microcephaly, moon face, widely spaced eyes, down slanting palpebral fissures, high arc palate, and wide flat nasal bridge. Diagnosis favor Cri-du-Chat syndrome. Newborn with microcephaly, atresia of the AR canal, deep set eyes, depressed midface, protrude mandible, deep set eyes, legs and flanks externally rotated, and hyperabduction. Diagnosis is de Gruchy syndrome. A child with history of severe hypotonia at birth has small hands and feet, hypogonadism, hyperphagia, obesity, and mild intellectual disability. Diagnosis favor Prader-Willi syndrome. A child with hypotonia, jerky ataxic movement, fair hair, large chin and mandible, inappropriate bouts of laughter, and severe intellectual disability. Point favor diagnosis: Angelman syndrome. Child with intellectual disability, supravalvular aortic stenosis, hypercalcemia friendly cocktail party personality, and strabismus. Point favor diagnosis: Williams syndrome. Most common cause of hypercalcemia in a child with Williams syndrome is idiopathic. Wilms tumor, aniridia, genitourinary malformation, intellectual disability, long face, upward slanting palpebral fissures, ptosis, and beaked nose due to absence of X6 and WT1 Wilms tumor genes. Diagnosis favor Weger syndrome. Newborn with coloboma, congenital heart defects, corneal atresia, growth and intellectual disability, GU abnormalities, hypogonadism, and ER abnormalities. Point favor diagnosis: Charge syndrome. Vertebral defects, anal atresia, cardiac defect, tracheoesophageal fistula, and esophageal atresia, renal anomalies, and limb defect. Point favor diagnosis: Vectoral or Vater association. The most common association with Vater or Vacteral syndrome is congenital heart defects. Cleft palate, absence thymus, hypocalcemia, tautology of Fallot, interrupted aortic arch, recurrent infection, short stature and behavioral problem, point fiber diagnosis, DiGeorge syndrome. Cleft palate, microgenthia, glossoptosis, respiratory distress, airway obstruction caused by backward displacement of the tongue base and feeding difficulties. Point fiber diagnosis, Peary-Robin sequence. Newborn with disruptive cleft on the face and amputated digits. Point fiber diagnosis, amniotic band sequence. Early fusion of sagittal suture, head is long and narrow. Point fiber diagnosis, scaphocephaly, most common type of craniosynostosis. Newborn with craniosynostosis, brachycephaly, strabismus, hypertelorism, maxillary hypoplasia, syndactyly, single nail broad thumb, point fiber diagnosis, Apert syndrome. Short stature below 3rd percentile, short length of proximal segment of upper arms and legs, rhizomelic shortening, trident hands, stenosis of the forearm magnum, and macrocephaly, flat nasal bridge, point fiber diagnosis is achondroplasia. The most common cause of death in children younger than 4 years with achondroplasia is brainstem compression. A child with multiple bruises, blue sclera, recurrent fractures, hyperextensible joints and had delayed closure of fontanelle, point fiber diagnosis, osteogenesis imperfecta, type 1 is the most common. Adolescent, tall, the lenses dislocated upward, high arc palate, pectus carinatum, aortic dilatation and lumbosacral ectasia. Point fiber diagnosis, Marfan syndrome. Eight cephalot spots, freckling of axilla, Lesch nodules, optic glioma and pseudoarthrosis of fibula. Point fiber diagnosis, neurofibromatosis type 1. A 20-year-old with family history of 8 nerve masses present with hearing loss, tinnitus, loss of balance and visual defect. Point fiber diagnosis, neurofibromatosis type 2. Adolescent present with facial acne which is not responding to treatment, has ash-leaf hypopigmented macules, facial angiomas, adenoma sebaceum, nail fibroma, pitting of dental enamel and renal angiomyolipomas. Point fiber diagnosis, tuberous sclerosis. Infantile spasm is commonly associated with tuberous sclerosis. Helpful sign to assist in early diagnosis of tuberous sclerosis is ash-leaf spots, hypopigmented macules. Most common cardiac finding in infant with tuberous sclerosis is cardiac rhabdomyomas. A child with partial albinism, white forelook, permanent grey hair, iris, heterochromia, cleft lip and cochlear weak deafness. Point fiber diagnosis, Waardenburg syndrome. A child with history of hypoglycemia and omphalocele at birth, coarse facial features, large tongue, earlobe creases, posterior auricular pits, Wilms-Timon and cryptorchidism. Point fiber diagnosis, Beckwith-Wiedemann syndrome. Newborn, large for gestational age, macrocephaly, prominent forehead, hypertelorism, intellectual disability, large hands and feet. Point fiber diagnosis, Sawtooth syndrome. Thank you very much everyone. Please do subscribe and share my channel. Thank you.